Next up, while he's getting his slides up, is Professor Dan Kelly. He's a professor here in Notre Dame's law school. He's a graduate of Notre Dame, so I have to give props to one of our alums and a graduate of Harvard Law School. Here at Notre Dame, he's a professor in the law school and the director of our Fitzgerald Institute for Real Estate. Dan teaches and writes in the areas of property law, real estate remedies, and wills, trusts, and estates. And today he's going to talk to us about affordable housing, community, and health. Dan?
Thanks very much, Melanie. Would like to highlight an issue that several of the presentations earlier today alluded to, which is the relationship and the correlation between housing and health. And housing here, I'm thinking broadly in terms of homeless populations, populations that may be on the brink of losing housing or housing instability issues, as well as affordability more broadly, right? To the extent that resources go to people's rent or mortgage, that means fewer resources that might be used for healthcare or food or other things that might affect health outcomes. So I want to just highlight a couple of issues today. One is just the general point about this nexus between housing and health. And I just want to give one study from the New England Journal of Medicine that sheds light on this issue, that it's an issue not only about housing itself, but even more broadly about communities and neighborhoods, which again is pretty intuitive, but I think the research is still at a relatively early stage in terms of showing causality. And obviously there's a lot of these, both housing and health can be correlated with other things like income. So actually figuring out what's driving what is not always easy, but I think there actually is something important here. And then at the end, I'll just say a few words about what our institute, the Fitzgerald Institute for Real Estate at Notre Dame, is both currently doing and thinking about doing in this area. So just to kind of motivate it a little bit, if you think to yourself, what's the relationship even in your own life between housing and health? Again, I think the intuition is relatively straightforward. First, having some place that's a house, whether it's a home or an apartment, is sort of intuitively important on the basic level of sheltering from the elements, etc. But in addition, sort of substandard housing is clearly an issue. So whether something's not up to code, or Marilyn Miranda talked before about her research institute and the concerns about lead paint. All of these issues could go into health outcomes. In addition, clearly, if housing is not affordable, that is, just say somebody is paying 50% of their income to their mortgage or their rent rather than 30% or 25%, that means a lot fewer resources that could be spent either directly on healthcare, filling prescriptions, doctor's visits, et cetera, or indirectly on things which have also been discussed today in terms of food, access to healthful foods, and other things, exercise, that could actually drive health outcomes as well. The other point I wanted to highlight too is there's been some significant research on not only physical health, but mental health outcomes. So I think that's important to keep in mind, especially when we talk about housing instability and the stress that can cause. And finally, again, what I want to emphasize is not only, and this leads into the example, not only the housing structure itself. I think all of us, based on our experience with COVID, I mean, we all love our homes and our apartments, but if we don't have a broader community, both in terms of positive things we can do in the community, between social networks, between amenities, ability to exercise, as well as, there's big literature on, negative things that could be in the community, whether that's pollution sources being by roads. So the built environment and neighborhoods also is an important aspect here. So just for the motivating example, some of you may be familiar with this study that was done in the 90s by HUD that looked at 4,600 low-income families with children. It was a randomized trial that took place in several major metro areas. Essentially, the experimental group was giving housing vouchers for they could use in low poverty areas in year one and anywhere after that, plus some counseling. There was kind of a secondary experimental group of housing vouchers that could be used anywhere. And then the control groups were not giving housing vouchers, but remained eligible for public assistance and benefits. Some interesting findings. Some of the outcomes or some of the descriptive statistics. So the voucher recipients tended to live in lower crime neighborhoods. They had better units than the control group. There were some inconclusive or ambiguous or non-statistically significant results on certain aspects of education, employment, and earnings. However, there were some unexpected consequences, including some that dealt with health, right? So just for example, parents and families who moved to some of these low poverty areas had lower rates of obesity and depression. That study spawned a wide range of papers on lots of different topics. I wanted to just highlight one that Jens Ludwig at the University of Chicago and a number of multiple co-authors did on neighborhoods, obesity, and diabetes. This appeared in the New England Journal of Medicine. And two of their findings directly kind of put the health and obesity and then A1Cs for diabetes. They found essentially in the results that both on the body mass index measures as well as on the A1C for diabetes, that they were lower in the group that received low poverty vouchers. And so their conclusions there are sort of, although modest in effect, basically that there might be an opportunity, going from high poverty to low poverty areas that may have these modest but potentially important ramifications in the prevalence of things like extreme obesity and diabetes. And so the mechanisms, their study kind of, it's unclear, right? Because there could be multiple mechanisms going on here, but they sort of suggest this warrants further investigation given the potential impact on health. To kind of just broaden out a little bit in terms of housing, 3.9 million American families, extremely low-income households do not have access to affordable housing. So this is a widespread problem in the United States. Over 500,000 people each night are homeless. So that would obviously be the most severe category that we're talking about. And on an annual basis, close to 1.5 million people pass through shelters. Again, just some kind of dramatic statistics here. This isn't showing any kind of causation, and obviously even the correlation, there could be other variables driving this, but there's a whole slew of things in terms of the homeless where the statistics are just not good whatsoever in terms of diabetes, HIV, depression, lots of bad health outcomes here for the homeless. Broadening out again to neighborhoods, the Robert Wood Johnson Foundation, which was invoked earlier today as well, did some interesting studies in terms of life expectancy across different cities. And again, some of these things could be driven by many different mechanisms, but pretty dramatic that you could have a 25-year life expectancy difference in just a matter of a few miles in New Orleans. Similarly, in Kansas City, Missouri, just to take another city, 14-year life expectancy in the distance of a few miles. Minneapolis, St. Paul, similarly within 3 miles, 13-year lifespan differences. It definitely seems like there's an underlying issue here that needs some research. So what are we thinking about doing? What are we currently doing to kind of look at and shed light on this issue? Well, a couple of things. So we launched our new institute that's focused on real estate with a specific priority on housing and affordable housing in 2019. We think this is very consistent with Notre Dame's mission, especially looking at the most vulnerable, the homeless, and others who are in need of these resources. We definitely want to take a data-driven and evidence-based approach. One thing that I really wanted to highlight, because in my review of this literature, sometimes I find that the people kind of fall into static models and thinking about some of these issues in a very static way. We really believe that there's an opportunity if we look at this as a dynamic problem. So what do I mean by that? For example, we can improve outcomes, we believe, across neighborhoods and communities by creating a greater supply of all types of housing, right? So that includes shelters, that includes affordable housing, that even includes market-based housing. There's some recent research suggesting that even the addition of market-based housing is a very good thing for affordable housing because you have a filtering effect that takes place. So we think improving affordability and the supply of housing could really improve outcomes across multiple variables, including health, and as well as improving quality of the structures themselves. I think to solve such a big problem, we really need a multidisciplinary or interdisciplinary approach. And I just highlighted a few of our faculty fellows who are currently working on projects. You can see they're coming from different departments and colleges and schools. Kim Rawlings, I saw participating in this conference earlier today. She has some really interesting research on the built environment and outcomes on physical and mental health. We have several people in engineering working on innovative housing structures that could reduce costs. At the law school, several of my colleagues have some really interesting papers. And in economics, you heard earlier from Bill Evans on the House side. He and his colleagues also have a lot of focus on housing and homelessness. So the last point is just to suggest, and we've actually started a partnership with the Lab for Economic Opportunities. We have our first cohort that's going to be going through in 2021. Leo has partnered with 6 nonprofit organizations throughout several states, including California, Texas, Ohio, and Florida, really doing a systematic randomized control approach to see, understand not only the causes of homelessness, but also potential solutions and interventions. So we believe that this is a useful first step to understanding some of these deeper issues. We think it's just the beginning. We hope to expand our efforts in affordable housing. And ultimately, we see Notre Dame being a major player in the space by bringing together partners across the university and partnering and collaborating with people throughout the United States and the world to tackle this really important issue. Thanks very much.
Thanks so much, Dan. I'm just as you can imagine, thrilled to have you be able to participate in this retreat today. And for those of you, that don't know, one of my roles here is helping launch some of our centers and institutes. So I work very closely with Dan and the others from the Fitzgerald Institute to launch that center institute here on campus. And so I was glad that there was a great fit here. And so hopefully, again, just like with everything else you've heard here, something can spark and we can get some collaborations going. And so thanks again, Dan, for taking the time to participate in this. It's really appreciated.
Thank you, Melanie.
So, thanks, Dan.